Joining us for another COVID-19 media update from CDPHE. A couple of notes before we get started on today's presentation. We do have a pair of interpretation channels available, one for American Sign Language and one for Spanish language interpretation. You can access those. We do have the American Sign Language interpreter pinned on the screen, and you can access the Spanish translation channel along the bottom of the console. You can use that gray slider bar to customize your view, and we suggest trying gallery view to give the best experience here. So our presenters today, Director Scott Bookman, our COVID-19 incident commander, and Dr. Rachel Herlihy, our state epidemiologist. We'll start things off with Dr. Herlihy.
Great, thank you so much. Good afternoon to all of you. Thank you for joining us. So I want to provide an update, as I usually do, on trends that we are seeing here in Colorado. So this figure is showing you our 7-day moving average number of cases. You'll see that in today's figure, I have drawn a horizontal line just below 5,000 to indicate where Colorado's case numbers are. So our 7-day moving average with that red line has just dipped below 5,000 cases. And that's, again, a daily average over a 7-day period of time. And so I put that red line there for all of you to see, to indicate how far we've decreased, but also how high our case rates continue to be. If you follow that horizontal dotted line over, you'll see that the case rates that we're seeing right now are really still the highest that we've seen since the beginning of the pandemic. You'll see that they're just below what we saw in the wave of illness that we experienced in November and December of 2020, but really at the highest they've been since that time. So again, case rates certainly making progress, continuing to decrease in the state, and we're feeling optimistic about the level of decrease that we are seeing, but still lots of COVID out there being transmitted. Next slide, please. And then very similarly, this is a figure showing our percent positivity data in the state. You can see that we've made great strides. So we've decreased from a level of 29% positivity in the state down to a value just below 16% now. So again, lots of progress being made. We've seen a rapid decline in percent positivity in the state. But again, the rate of percent positivity that we're seeing right now is still pretty unprecedented, really you have to go all the way back to the beginning of the pandemic when we had much less testing available to see percent positivity values this high. So again, lots of disease transmission still occurring in our community, lots of reasons to continue to be cautious, wear masks, get vaccinated certainly, and take all of the preventive strategies that you've been using throughout the pandemic seriously for the next few weeks at least. Next slide. I'm going to talk a little bit about the subvariant BA2. This is an Omicron subvariant, so basically a virus that looks like it's closely related and has emerged from Omicron, but has several unique mutations from the primary variant of Omicron that is circulating. So at this point, we have seen this BA2 variant increase pretty rapidly in some countries across the globe. Notably, the UK and Denmark in particular are places where we're seeing increasing rates of this BA2 subvariant. And there is some new data out of Denmark and the UK that is showing us pretty clearly that it does look like BA2 is able to successfully outcompete BA1, which is that primary subvariant of Omicron that has been circulating here in the US. At this point, the good news is that there's no evidence that vaccines are less effective than BA2. Here in Colorado, we've detected 3 cases so far, all in the Denver metropolitan area, caused by this BA2 lineage. We also have detected BA2 in our wastewater monitoring system. And at this point, BA2 has only been detected in wastewater utilities in Boulder County. So again, continuing to track this variant and understand what it might mean for Colorado. Again, very little detection here in the state. We know that in other places across the globe, it has taken off recently, and in some locations like Denmark, that has resulted in an increase in cases. Difficult to say what it might mean for Colorado and the US, where we haven't seen it rise as quickly. Next slide, please. And then finally, wanted to make sure that all of you were aware that the Colorado School of Public Health did release an updated modeling report last week. That modeling report highlights that we're clearly seeing a decline in cases and hospitalizations and expect that to continue in the coming weeks. Though again, as I've shared earlier in this presentation, Colorado is still experiencing a very high level of disease transmission. In fact, the modeling team estimated that 1 in 19 Coloradans was infectious with COVID-19 actively as of those estimates last week. They are estimating that immunity to Omicron is high in the state and rising, and modeling that about 80% of the state's population may be immune to Omicron by mid-February. So again, that is giving us reassurance, causing us to feel cautiously optimistic that the next few weeks and months are going to look better and better for Colorado and the US as far as COVID-19 transmission. But of course, feeling cautious in that we know that new variants can emerge. New subvariants like BA2 could potentially present new challenges to us. And with that, I will hand it over to Director Bookman.
Thank you, Dr. Herlihy. Thanks everybody for joining today. And I do want to echo Dr. Herlihy's comments there. Cautious optimism is certainly where we are, but as you look at this slide up here today, well, we do see the kind of precipitous drop in hospitalizations, and we are now down to 1,162 COVID-19 hospitalizations. It's important to look at the right side of that graph and see for how long our hospitals have been dealing with this incredible surge of patients. This upward trend began in August. It has continued into February, where we have this large number of people hospitalized with COVID. And while it is coming down, and while percent positivity and case rates are all heading very much in the right direction, I think it is important to acknowledge how hard our healthcare workers and first responders on the front line have been working, the stress that they have been under, the impact that these hospitalizations have had on them. And I really do want to continue to encourage all Coloradans to, keep wearing your masks indoors, keep getting tested when you don't feel well. Make sure that you stay home when you're ill. And most importantly, go ahead and get that first shot if you haven't gotten it. If you're due for another shot of another dose of your mRNA vaccine or your J&J, please get it so that you're up to date. We have a long way to come down from where we have been. And we want to ensure that every Coloradan is as protected as they can be as we move our way out of this wave and hopefully into a several month period here where we are in a consistently decreasing decline and really moving forward. So next slide, please. Good news here as well. Again, where you see our case rates, our hospitalization rates coming down. Importantly, on this slide, you do see the number of available hospital beds continuing to go up. And we're seeing a 7-day moving average of hospital bed availability higher than we have seen in quite some time, and on a trajectory of sustained upward movement that we also haven't seen in some time. So I do think there is a lot of positivity here in where we are headed with our hospital beds as of today. Next slide, please. Again, taking a moment to just thank all Coloradans who have come together to respond to this pandemic. Our free mask program has been an incredible success. And part of that success is how excited Coloradans were to take advantage of this free program, to get their free medical grade masks, to provide themselves and their families with an additional level of protection against this virus. And so since the inception of the program, we have now distributed more than 3.7 million free masks. We have done this at 431 distribution locations and such incredible community partners here. Our libraries, our fire departments, and other community locations where it is easy for people to access these really important tools to keep themselves, their families, their friends, and their communities safe as we continue to protect ourselves as the numbers come down. Next slide. And as I mentioned earlier, the continued importance of testing as another tool in our toolbox to make sure that we are minimizing the spread of this virus every time we get the opportunity to do so. One of those tools is our incredibly innovative program here in Colorado. Again, the first state in the country to set up a program where Coloradans could go online and order a test and have it shipped directly to their house for free. We have now distributed more than 2 million of these rapid at-home tests through our program, and we're excited to let Coloradans know that you can go to that website if you haven't ordered before. Now is an opportunity to order some of these tests. You don't want to order them when you're sick. You want to have them available so that if you do have an exposure or do feel that you need to take a test, you have it easily at your disposal. You're not waiting for it to arrive in the mail or needing to go out and get it from a store. So that's where that program stands. And I think, Brian, it's back over to you now.
Thank you, Director Bookman and Dr. Herlihy, for that information. We're going to go ahead and open things up to the media Q&A portion of this afternoon's availability. We'll use the raise hand function. You can find that along the bottom of the Zoom console. Let's start with first questions first. Time permitting, we'll be able to come back for some second questions or follow-ups. Please state your name and the outlet you are working for before asking your question. And anything we aren't able to get to today or that isn't covered in the press conference, feel free to email us, please, at media_info@state.co.us, and we'll get back to you as soon as we can. Let's go ahead and start things off with Sarah Flower.
Hi, thanks for taking the calls this afternoon. This one is for Dr. Herlihy about this new variant. This is a good news, bad news information of like things are getting better. We're on the decline of a lot of hospitalizations and positive tests. How concerned are you and your team about this new variant right now? Thank you.
Yes. So I think the first thing I want to make sure that people understand is that this is really a subvariant. So this is a type of Omicron and while it has some unique mutations and is different from the Omicron that has been circulating here in Colorado and in the US, it is related. And so we do expect there to be more cross protection than we would have seen perhaps with the variant change from Delta to Omicron. So this is not the same situation as Omicron emerging when our immune systems had previously seen Delta. This is different. This is really it's Omicron. It's like Omicron. It's similar to what we've been experiencing. And so we don't necessarily expect to see the same sort of large wave that we saw with that Delta to Omicron switch. That doesn't mean that we couldn't potentially see, an extended period of transmission, slowing in our decline. But I think at this point, we really don't know exactly what it's going to mean. We've seen different patterns in different countries. So Denmark did see this sort of flattening of cases following their surge in BA1. And then as BA2 emerged, they saw a rapid increase again in cases. But the UK has seen more of a flattening trend. So difficult to predict exactly what it could mean for us. And of course, it's not, we don't know for sure that BA2 is going to take off here. So lots of questions remaining, but it's something that we're going to be watching closely in our surveillance data and keeping track of it, and of course, keeping you informed as we see changes.
Great, let's go to Alex Rose.
Hey guys, thanks again, as always, for holding these type of briefings. I hope you bear with me for a second on this one. So earlier today, just about an hour ago, actually, the governor of Iowa announced that they're going to be ending their disaster emergency proclamation. Essentially, their state is going to start treating COVID-19 like it treats the flu and other infectious diseases. Do you think Colorado is at that point right now? And do you foresee a time in the near future where the state will start managing COVID-19 like it manages the flu? Thank you.
So, Alex, it's a great question. And obviously, you see a great desire amongst everyone to move forward and to move past this pandemic. It has obviously been an incredibly difficult 2 years, and we all want to move on with our lives. And so we are looking at short-term and longer-term scenarios and starting to do some planning around how do you live with this virus in more of an endemic environment. An endemic just means that it's with us. And what we're going to see most likely is new variants come up. We'll see additional waves hit our state, our country, the world. And we need to be prepared for any number of different scenarios. But what we do know is that we're going to have to take an assessment of things here and really look at how we've provided services to this pandemic over the last several years, and think about, how do we start moving some of this work into the more traditional environments of the healthcare system, while being, continually being prepared to ramp up and respond to, variants of concern that may come up.
All right, let's go to Seth.
Hi, Seth from the Gazette. Dr. Hurley, I think this is probably for you. Can you speak to what you're seeing as far as transmission and case rate among school-age children since the wave has started to decline over the past few weeks? Thanks.
Sure. So we're actually seeing very similar case rates right now among all age groups in the state. Several weeks ago, we were seeing higher case rates among school-age children, but they actually seem to have come close in line with the same rates that we're seeing in adults and then young children as well. So pretty similar across all age groups.
All right, let's go to Jessica Seaman.
Hey, both of y'all mentioned that Coloradans should still wear a mask indoors. I wanted to see if you think some of the Denver counties, metro counties that are lifting their mask mandates are doing so prematurely.
Our local partners are all making the right decisions for their jurisdictions at the right time. And I think what is important to understand here is that there's a very big difference between a mandate and a continued recommendation to wear a mask indoors. And so our local partners will make the best decisions for their jurisdictions, and we will be here to support them with the information that they need and the technical assistance to make those decisions. But what I really want to reinforce for all Coloradans is that while we continue to have disease rates that are as high as they are, it is really important to continue wearing your masks indoors. Those same public health principles that we have stuck to now for 2 years around vaccination, around testing, around self-isolation, and around mask wearing indoors, none of that changes at this point in time.
All right, let's go to Katie Pelton.
Hi there, Katie Pelton with KKTV 11 News in Colorado Springs. Thank you so much for holding this today, and all of them. I've checked in with you guys a couple times with the state, and I know the mask program obviously has been extremely popular. People are calling us all the time about it too. I know in the past, the state and the governor have said that you'd be sending those masks directly to homes, like those testing kits. Any update on that? Do you guys still plan to do that? If so, when do you think it'll roll out? Weeks, months? Any idea there? Thank you so much.
So at this point, what we have seen is that, we've had incredible success in people going and accessing, these free masks at their community centers. What we have also seen is the beginning of the federal program that is allowing people to order those masks online and have them shipped directly to their home. And so we don't want to create any duplicative programs to what the federal program is. And so right now, we're just evaluating and making sure that all Coloradans have access to this incredibly important tool. If we find ourselves in a place where we need to add a program like that, we will certainly do so. But right now, I think what I want all Coloradans to know is that you can go to our website, you can find out, in locations across the state where you can go pick these masks up. Also make sure people are aware that there is a federal program that is shipping to community health centers and to pharmacies. And that there also is the program through the U.S. Postal Service where you can sign up and have masks delivered directly to your home.
Let's go to John Daly.
Hi, John Daly, Colorado Public Radio News. Thanks for taking our questions. I guess this is for Scott, but maybe for both of you. Can you speak to the value and importance of wastewater surveillance going forward? And you were talking about sort of, Scott, the next phase of the pandemic and kind of adjusting to that. How important a tool is that? And is it the kind of thing where you feel like the state could take a pretty targeted approach where you can see things popping up via the wastewater surveillance and then respond accordingly? Thanks.
Do you want me to take that question? I can
Do you
do that.
want to go first?
Sure. Yeah, so we are really excited about this new tool we have in wastewater surveillance, and do think it is really a pretty fantastic and sophisticated tool to try and understand transmission early and changes in trends early. We, I think, are still really trying to figure out how to best use wastewater surveillance data. And I think the tools are going to evolve a lot in the next couple of years as we get more and more comfortable in using this data. But you're absolutely right. It is a great new tool, does help us try and understand where transmission may be occurring as time goes on, and perhaps we have less widespread transmission. It will help us understand regional differences. It's also been incredibly useful for us in understanding the emergence of new variants and looking for those variants and where they might be occurring first in the state. So I think lots of uses for wastewater surveillance, but we're still really figuring out how to best put it to use.
All right, let's go to Vinny.
Thank you. This is Vinny Del Giudice at Bloomberg News in Denver. Dr. Hurley, you said, and I want to make sure I get this right, 80% of Coloradans could be immune by mid-February. Does that mean they won't get it, or they won't give it, or both? And could something slip in the back door and infect them? Thank you.
Yes, so that projection from our modeling team is immune to infection, and that does refer specifically to Omicron. So of course, if we see a new variant emerge, or if a new subvariant has some changes or mutations in it that result in that variant or subvariant escaping our immune system, that would obviously be a significant change, and those numbers would not necessarily hold up. We know that immunity is a moving target. We know that we're gaining immunity as the population's infected, as the population's vaccinated, but as time goes on, we also see waning immunity. And so, we expect that to be a fluid number. We don't expect it to be constant. We know that as immunity wanes, as we get further and further out from this Omicron surge, that could potentially make us vulnerable again, our population vulnerable to reinfection. And there's a lot we really need to learn about the duration of protection following Omicron infection and following vaccination against Omicron. So I think lots to learn in the next couple of months, and we'll be, of course, updating that modeling work as time goes on.
All right, let's go to Kathy Walker.
In follow-up to Vinny's question, based on the modeling, did you expect that the numbers today would be even more dramatically down than they are? I mean, we're not that far away from mid-February.
Difficult to say. I think we certainly have seen a really rapid decline in cases and positivity and hospitalizations. Would I love to see that decline faster? Yes. But I think we're in a much better place than we were several weeks ago, and hope to continue to see that decline. And of course, we'll be watching for any new challenges that could be coming our way that would reverse that trend. But right now, I think things are looking promising. We're just hoping we can get to much lower rates. The rates that we experienced, between waves. Would really be the goal, to try and reach those lower levels of transmission, lower levels of hospitalization and percent positivity that we really haven't seen for a very long time in Colorado.
All right, do we have any other first questions in the group today? All right, let's go back to Katie Pelton.
Hi, Katie again with KKTV. Another question for you. I just saw in the last hour that the CDC is now saying unvaccinated people are 97% more likely to die of COVID than those who are fully vaccinated and boosted. Kind of a surprising statistic that I saw today. I was wondering if any of you could comment on that or have any further information about it. Thank you.
Yeah, I haven't had a chance to see that statistic yet, but we certainly know from Colorado specific data that our unvaccinated population does continue to be at much higher risk of not just infection and hospitalization, but death as well. We are working on updating our dashboard to show that clear difference in risk of death, hospitalization, and infection for individuals that are fully up to date, boosted, have received that third dose compared to those that are not yet boosted, and then compared to those that are unvaccinated. And we do see a really significant risk difference between individuals that are unvaccinated and those that are vaccinated, and especially those that have received that third or booster dose.
All right. Thank you, everyone, for joining. Thank you, Dr. Herlihy and Director Bookman, for your time today. If there are any questions we were not able to get to or anything that wasn't covered today on the press conference, please email us at media_info@state.co.us, and we'll get back to you with some information as soon as we can. Thanks again. Have a good afternoon.